Oh,
Hey, can someone put this on Facebook?
okay. So we're basically going to be starting up with you guys. We're going to be asking you guys for the flow of the anesthetic machine. Okay, lock it. Okay, so we're going to be these are all the parts of the anesthetic machine. We have the basic flow, your flow for your rebreathing system and your non-rebreathing system. Hi, MTV Awards. I accept this award. So with your basic flow, gas flows up to a certain point in the anesthetic machine for both the rebreathing and the non-rebreathing system. So it's at this point, it'll branch off and it'll go to either circuitry. So if we know the basic flow, and again, you don't even have to set up anything in the basic flow, you just need to know it for in your assessment when you do set up the anesthetic machine. 4 random cards will be given to you, and you do have to put them in order of flow. Okay, so with all that's on the board here, what's the first stop? Where does it start?
Oxygen.
Oxygen. And oxygen is represented by what in the anesthetic machine? The hose. Not that one?
The white cord.
The white cord. So this is where it all starts. Oxygen. Since we do not have an oxygen tank and all that, we won't simulate an oxygen tank or anything like that. So we basically just tell you to point oxygen to this hose. But for knowledge sake, you do know it starts at your oxygen tank, to your oxygen regulator, through this hose, and then the next step, you guys tell me. What's the next step after oxygen goes through the hose? This is step number 1 here.
Okay, what I missed? What? Oxygen?
Oxygen. That's where it all starts. What's the next step for our gas on the anesthetic machine?
Flow meter?
Yeah.
Flow meter.
Oh,
Flow meter is located here. What does the flow meter do?
Measures how much oxygen?
Measures how much oxygen that is given to the animal. How is it measured? What unit is it measured in?
I'm sorry.
Liters. No one? Okay. It's measured in liters per minute. The flow meter measures oxygen in liters per minute, and that is how much oxygen that is given to the animal. Okay? What's the next stop after our flow meter?
Vaporizer?
It's under endotracheal tube.
Oh, oxygen. Okay. Who said what?
Vaporizer?
Vaporizer. Good. What does the vaporizer do? Hi.
It vaporizes the anesthetic. Anesthesia?
It turns the
It's a
anesthetic
liquid.
liquid into a gas.
Yeah.
Go back to that. Yeah. How is anesthetic measured? In what unit is anesthetic measured? I'll give you a hint, 2 circles and a line.
What?
Percent?
Percent. There we go. Genius. How does no one else get this hint?
Because we're on video, we feel awkward. We're all afraid to answer.
No one knows your voice. I'm the one who's being seen. Oh, there we go. Perfect. Okay, so from your oxygen to your flow meter, oxygen measured in liters per minute, to your vaporizer, anesthetic gas is measured in a percentage. Good. So now your whole kitchen concoction is made up. These 2 gases are mixed. And what is it called?
Fresh gas.
Fresh gas. Oxygen and anesthetic is called fresh gas. And what is the next stop after your vaporizer? It's the last stop in the basic flow before it branches out.
Fresh gas.
Fresh gas inlet. Good. This is your fresh gas inlet here. And this is where your basic flow ends. This flow is the same whether you have to set up the rebreathing system or the non-rebreathing system. Now, we're going to get a nice little volunteer for us. Okay? And we're going to set up either one of these machines, but let me just touch bases on something first. How do you know whether to use the rebreathing or non-rebreathing system?
The weight of the animal.
The weight of the animal. And how is this weight specified? What weight is used for the non-rebreathing system? What weight is used for the rebreathing system? The kilograms? Okay.
Isn't it over 10?
No, it's over 8 breathing.
Over 8 kilograms is the rebreathing system.
I said
Under
all
8
those.
kilograms is the non-rebreathing system. Some people came up and they asked, what if the animal weighs 8 kilograms? So we specified it for you guys. 8 kilograms and more is the rebreathing system. 7.99999999999 and less is the non-rebreathing system. Now that you look at the two pieces of circuitry, how can you differentiate? How would you know which is which with the circuitry? There are actually two things that the rebreathing system has that the non-rebreathing system doesn't have. What is that? The thing.
That thing.
That thing? That thing.
Soda lime thingy.
The soda lime thingy.
Yeah.
You know what I like?
Canister.
You know what I like? I like that the fact that it's up on the board. They say most of it, and they still say thingy at the end.
Canister.
The soda lime canister. Again, because this is the rebreathing system, it filters as much as it can, so it can use some of the anesthetic gas that came out or some of the oxygen that came out, and that is refiltered back to the animal. However, with the non-rebreathing system, what the animal breathes out is coming straight out the scavenger and out the system.
And killing pigeons.
And killing pigeons. As you can see on my little schematic, I have some pigeons on the side. That's awesome. Thank you very much. Okay. So, we have a dog. Let's say he's 10 kilograms and his name is...
Bruno. Bruno.
Charlie.
Bruno.
Pickles.
Bruno.
Okay, who says Bruno?
Yes, everyone. Hands up.
And who says Charlie?
Okay, Bruno has more votes.
Okay, so 10 kilogram dog Bruno needs to be hooked up to the anesthetic machine. And because you won, you selected yourself to come and hook up the anesthetic machine. So you come do that first.
Sucker.
Who, me?
That would be you.
You just
Really?
voted yourself to come out. So.
No.
Yes, you did.
What am I doing?
You're just hooking up Bruno to the anesthetic machine. Okay, so first off, he's 10 kilograms. Which system would you use?
Keep in mind, you're on camera.
Rebreathing system.
That one.
Yes, you will be using that one.
Okay.
Guys, you are helping her.
Please.
Okay? Now, go for it.
Do you know what the
Alright.
oxygen in?
So, what tube should we use?
The big one.
Why? No one knows. Bigger.
Bigger dog.
Bigger animal, yep. Okay, so I don't know how to hook that up anyway.
Come on, guys, help her out. Help
Hold on,
her
you
out.
have to do the other tube first.
Wait, what other two?
That tube. And so it's U-shaped. That tube. Yeah.
I like that.
That
I like
in
that.
there.
I did do it, so it's U-shaped. I
Alright.
like that.
U-shaped.
Yeah.
One. Okay.
I bet you everyone's going to remember that now. Like,
U-shaped.
Okay. Then another one goes on. See the red circle?
Yep.
Plug it in.
Plug it in, plug it in.
never did that.
Blade?
And then don't you?
Don't hook it up to the dog yet, right? No.
You can hook it up to the
Don't
dog.
hook it
That
up.
one goes on the dog.
Okay. Hello. It's nice meeting you.
And now you need a balloon.
Which one?
The blue one.
But why?
Because it's bigger and it's blue.
Okay. So that goes somewhere.
There, yeah.
And then you do the scavenger one.
Scavenger.
Yeah.
Got it. I don't know where it goes though.
There's one
On
at
the back.
Which side?
Doesn't matter.
Yes, it's the same.
Oh, here. Move it out of the way.
You guys mind just turn that to the side for the rest of us?
Okay, so how do you think she did? Did she get a 5 out of 5 or should I fail her?
I think she did pretty good.
She did pretty good, so you think she deserves a 5 out of 5?
Yes.
Okay.
Alright.
Alright. I think yeah, you get a 5 out of 5.
Good job, guys.
Okay, so Now we're going to, no. Now we're going to continue the flow of gas from the fresh gas inlet pot. So from the fresh gas inlet, it's going to be moving through the fresh gas inlet tube. What's the next stop after that?
Did you just break something?
Yeah. So, where's the next stop after that? From your fresh gas inlet tube, it's now moved towards your rebreathing circuitry. Next stop for that. No, not just that. Think of it this way, rebreathing bag.
Oh, rebreathing bag? The balloon, the big balloon.
Some of the fresh gas needs to go to the rebreathing bag. Remember when we said sometimes the animal might need to take a deeper breath? So the bag will help. So if the bag has some fresh gas in it, the animal can take a deeper breath from the bag itself. When I was breathing through, I didn't actually exactly know how that was working until I was actually breathing through the tube itself. But once that bag closes off, you actually can't breathe in anymore. So if the animal does need to take in a deeper breath and that bag has no air, that's it. You can't breathe in anymore. So again, even if the animal is under general anesthetic, the animal's body still reacts to pain. So things like clamping of blood vessels, cutting of tissue, sometimes you might get the blood pressure spiking up a little bit, an increase in heart rate, or even the animal taking a deeper breath. But he's not feeling it, it's just his body reacting to it. So, you now have some fresh gas going to your rebreathing bag. Where's the next stop for your fresh gas now?
Can I say my part now? Inhalation tube?
Inhalation tube. Which one is the inhalation tube?
The blue one, inside.
The blue one, the inside one. Good. So from your inhalation tube, what's the next step after that? You have one more endotracheal tube. Woo! Okay. So from your endotracheal tube, gas gets into your patient because he's inhaling, he's now anesthetized, he's knocked out, we can punch him and beat him, you're feeling crap. Now he breathes out. Where's your gas go?
Into the white, clear one, isn't it?
It goes into the clear one. What's the name of the clear one?
Exhalation tube.
To your exhalation tube. And is now leading back to your circuitry. What's the next stop after canister? What canister? Soda lime canister. What happens in your soda lime canister?
It absorbs the carbon dioxide.
It absorbs the carbon dioxide. Why is this important?
We don't want to go back in the blood.
Good. Some of this gas is reused. Remember, this is a cost-friendly, a lot cheaper because actually a lot less gas is used in the rebreathing system compared to the non-rebreathing system. So, with filtering out carbon dioxide, you can reuse some of that gas, but again, you will still have waste gas and some of that will be leading out the system. So what is the next stop for that waste gas?
Doesn't it go in the scavenger?
Not just yet. We have one more stop before that. Something that actually controls.
The pop-off.
Pop-off valve. Perfect. So on the rebreathing system, we have the pop-off valve here. What does it do? I just said it. I'll just give you guys an answer.
Controls.
Controls. I control. Controls what?
The
Controls.
anesthetic.
Controls. No? No one knows? Okay. It controls the amount of waste gas that leaves out the scavenger. So if this is closed off, nothing is leaving the system. Nothing is going out the scavenger. So we basically have air backing up. And when is this used? When do we close the pop-up valve? No one remembers? Bagging an animal? Yeah? Super CPR? Don't write that on your test if it's asked. Okay, so after your pop-up valve, what's your next step? Scavenger. Oh. Okay, so you have your waste gas, out your pop-up valve, out your scavenger, to the pigeons. So, let's go for the flow again. Oxygen, flow meter, vaporizer, fresh gas inlet, rebreathing bag, inhalation tube, endotracheal tube, exhalation hose, soda lime canister, pop-off valve, scavenger.
So what are we supposed to do with the oxygen? We're supposed to turn it on, or what are you?
No?
What
don't
are
have
you
to turn-
what are you checking when you?
No, none of this here you've been taught how to set up, so you don't need to worry about that.
Oh.
The main thing you do need to know is just how the circuitry and the hoses and everything is set up. And you do set up the right one according to your case study. Okay?
And you do need to know, like, your oxygen flow meter is liters per minute, then your vaporizer percent.
Okay. Do we have any questions on the rebreathing system? I take that as a no. Okay. So, I'm gonna unhook this. And I'm going to ask one nice little volunteer to help me out in setting up the non-rebreathing system.
Just broke something.
No, I didn't.
It's on tape too.
No, I didn't. Okay, so who's going to help us out in setting up the non-rebreathing system? Or do I get the joy of selecting someone?
I did the other one.
What?
Technically, you did.
It's okay.
So, anyone? No? Do I have to pick? Okay, fine, I'll pick. I like picking. Jessica.
Me? No, Sophia, I'm here. Pick someone else. I have no idea what the hell you're doing.
That's why we're here. We're learning.
No, I haven't
Everyone's going to
watched.
help you
He's always
out.
gonna pick you, Dustin.
I don't want.
The best way to learn is to do it
Visualize
yourself.
it.
That is how I learned. That is how Ruth learned.
I don't really like
That's how I learned.
Love you guys. Nope, okay.
Where's our little green marker?
It's
on the
floor.
Oh, really? So you're just going to deny me like that?
Yeah, honestly.
You're just going to
like,
stand up?
I wasn't here last
Our
week.
last lab, this is
I
how
got
you're
it
going
right.
to... Okay, fine, fine. I'll find you later.
Yep.
No.
Nikki, I'm taking notes. Too bad. So, I'll love to see you take notes for me then. Thanks.
Do you want to take notes for her while she comes
Sure.
up?
You better take good notes. Let's do it. Notes every word.
Wow, back in my days when I just used to pick them, now I have to negotiate.
Wait, maybe I should
We were riding on Tuesday, if you remember correctly.
Oh yeah. Anyone who wins gets a free coffee.
Oh, you're at the
Okay,
Too
so
late now.
Nikki is going to
Try.
succeed. Nikki's going to succeed in setting up the non-rebreathing system. And again, you guys are helping her.
No help. Let's go.
So, and of course she has Cassandra making excellent notes for her. Let's go, Nikki.
I don't remember any of this.
You don't remember any of this.
No, I don't.
And that is why you guys are here. Teamwork, only together, people.
Okay.
Just not on the day of your assessment.
Yeah,
Not
you
you.
don't remember this windows on this side? No.
No, under.
Bottom.
There you go.
Just pretend you need to help them breathe. It's easier to squeeze it down there. Oh, yeah, sure. Sure thing. No, it was sure thing. Like,
It's probably
oh, God.
Make sure. I need
Don't forget the first guy. Do I see the ones connected to you?
Dun, 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 dun,
Because
dun.
it goes on this part, but that
We
looks
should
different.
make up a song.
No, no.
You shape.
The oxygen's connected
You
to the flow meter.
Yeah, the
Flow meter's
oxygen
connected
thing.
to the vaporizer.
Hey! Yeah, but there's something that goes on here too. I can't remember what it is.
Look on the table, what do you see?
Dun, dun, dun.
So can I make an example of this? If in your practical you are doing this and I see that you've hooked this up and then you go looking for that one, I know that you're not sure. So,
Yeah.
and I'm not making I don't want to point anything out with Nikki, but you need to know where this stuff goes. And this system particularly is the one that I think can be a little confusing because you've got 3 outlets here that are all very close and very much the same size. So Nikki's actually getting some practice here, and that's good because she won't have trouble in her practical next week. And I would ask you to do the same thing, like come and set this up once we're finished going through this flow. Okay. So what are we going to do to fix what's happening?
Take that one off. Put the 2 on top of the green thing.
And then put that one in that.
Yeah.
hole. How am I supposed to take notes? That one there. See? That's why I should take my own notes. I'm gonna fail because you. It's all your fault.
So now it connects to the dog.
Where's this? Oh,
No. Where did it go?
Okay, that doesn't
Happens
fit
every
on there.
time.
Missing anything?
scavenger.
Check, yeah. Go back.
Oh, that one on the bottom? The bottom, yeah. I think. Don't quote me, but I don't know. It seems open.
What do you guys think? Is she
I
going
don't
to the
know.
right spot?
I thought it stayed in the back.
No.
No.
It's only for the bigger one.
So that's one thing. Really, once you get to the fresh gas inlet, up to this point in time, both systems use exactly the same stuff. Okay? But as soon as you get here and you're starting to hook up your circuitry, both systems have different setups. And that's one of the most common errors I see students make. They plug it in the back here. So you've got your scavenger and the rebreathing system to the back of this machine. Have a look when you come and look at the
Guilty.
machine. And in my non-rebreathing system, it's right here.
Okay, so yeah. That's probably
One of the mistakes I made. My mistakes.
Now, in terms of the non-rebreathing, students tend to want to do something with this hose. You can just lay it down, but know that normally the scavenge is hooked into the wall and it's pulled out into the outside.
See, the pigeons. So, how do you think she did? Is everything okay?
100%.
100%. Okay, so we're going to run through the flow again, starting from the fresh gas inlet. What is the next stop for your fresh gas? Through the inhalation tube. And that is one of the differences in the flow in the anesthetic machine between the non-rebreathing and the rebreathing system. In the rebreathing system, from your fresh gas inlet port, it goes to your rebreathing bag. Some of it will go to your rebreathing bag. In the non-rebreathing system, it does not go to your rebreathing bag. It goes to your inhalation hose. From your inhalation hose, where does it go?
Endotracheal tube?
Endotracheal tube. Patient breathes in, he's anesthetized, can't feel a thing. We're doing toe pinch, eye poking, tongue, jaw tone. He breathes out. Out the endotracheal tube, what's the next step for your waste gas?
The exhalation.
The exhalation hose. And then from your exhalation hose, what is the next step after that?
The bag.
The rebreathing bag. After your rebreathing bag, pop-off valve. Do you remember what the pop-off valve does? Controls waste gas. Basically, you can control how much gas is escaping out your scavenger. You do want it open during your surgical process. When bagging an animal, you'll be opening and closing it. We'll run through that in a second. What's the next stop after your pop-off valve? Scavenger. So, here you can actually see the difference between the non-rebreathing and the rebreathing system. Fresh gas gets to your patient, fresh gas leaves your patient, out the circuitry, out the building. No filter. Okay, any questions? No? Okay, we're going to run through bagging. Okay, we're going to run through bagging. You are in surgery and your patient is starting to arrest on the table. You are monitoring all the systems and you see this is happening. What is the first thing you do?
Vet.
Tell the vet. Good. After you tell the vet, what is the next thing you do? Think of it this way. The patient is starting to lose his body function. What is one thing we are doing to this animal that's probably causing that?
No.
Cut off the anesthetic.
Turn off the anesthetic.
Any more oxygen?
No, not
Well, like
necessarily.
You might want to bump up.
Yeah.
Yeah.
That's the idea of bagging, is actually getting more oxygen into the lungs. But the animal's not breathing at this point in time.
Okay.
So
you have to,
he's,
it's almost
but
like you have
you-
to make it breathe.
you're making him breathe.
Yes, it's like
So you
super
have to
CPR.
Squeeze the bag.
Not just yet, because we're now turning off the anesthetic gas. So no more poison to your animal. What is the next thing we need to do?
Pop on.
Pop-off valve. What do we need to do to the pop-off valve?
Open it.
Open it? Close it. If you close it, what happens? Cuts off the flow to anything leaving out the scavenger. So what happens to something hooked up to the circuitry here?
blocked.
Yeah, so if we've stopped flow going that way,
There's nothing that
what happens? I get my bag filling up, and really I would over time get pressure building up in my system here. I mean, I don't want that to happen. That's why we bag. It's active. So I close my pop-off valve. This will fill. Now at this point in time, it's filling with oxygen. I don't want anesthetic gas going into this animal's lungs at this point in time. But I basically am forcing oxygen into there. I've got his lungs captive because I've got him intubated, which is, in my estimation, better than if I have to do CPR on an animal just breathing into the nose. Because what I breathe in there is not 100% oxygen, but what's coming through this machine is. So I squeeze the bag. Because this is closed, that can only go that way into his lungs. Why do I have to open the bag almost immediately again?
So it refills?
Refills, because I squeeze in here. Now please understand that there's way, way, way more to anesthetic than what I teach you in the machine. It's much more complicated. This is a very good base to start with. But that fills back up with oxygen, so I can close it, squeeze, open. And that's the motion, okay? So, I mean, when you get into further studies, if you do that, how much you squeeze in there is important too. And I use this little, what's called a manometer. I'm not going to go over 20 centimeters of H2O. You don't need to know that for a test, but just understand I'm teaching you very basic. Close, squeeze, open. Close, squeeze, open. That's called bagging the animal. When do I stop doing that? When he's breathing again. He doesn't need me to help him anymore. There is one other place that bagging the animal is useful. And it's a totally different thing than bagging an animal that's under respiratory arrest. Do you remember at all what we talked about?
For specific type of animal, specific species. You have tons of them in the center.
So what cats do sometimes, for whatever reason, likely to do with the anesthetic drugs that we're giving them beforehand, sometimes they won't hold their breath, but they don't take just nice normal breaths. Well, if they're not breathing in what I'm sending to them anesthetic-wise, they're not going to get anesthetized. Because that whole act of breathing is what gets them there. So I may need to then bag the animal just to force some of my anesthetic into those lungs. The difference between this and what we were just talking about with our respiratory arrest is I still have my fresh gas. I want anesthetic going into those lungs so that the animal inhales it. But I would not do that for too long. If I've given my animal a couple of bags and things are not changing, I'm going to start wondering about my anesthetic equipment, the health of my animal, that type of thing. But that is another scenario where we might bag the animal. What is an entirely different scenario? So, you've gone through sort of both systems. I just want to make sure that you're clear on what you're going to be tested on when you come in for your practical next week. So you're basically going to be coming in and given a case study like we have with every other thing that we've done this semester. What's the first thing that you should be looking on when you get that case study for the setting up of this anesthetic machine?
How much they weigh?
How much they weigh. It's the easiest part of this whole practical because that decides rebreathing versus non-rebreathing, and it's easy. I'm not going to give you the weight in anything but kilograms, so you don't have to do conversion of pounds to kilograms. Just look. If it's over 8 kilograms, get busy. Get your rebreathing stuff ready. If it's under, get the non-rebreathing. Get it set up. There will be an animal. Probably, it might even be this animal set up, intubated like this one is on this table, and likely a cat on this one with a tube in. Set up that system. I want to make sure you know which system to choose and how to put it together correctly. The order of how you hook things up in terms of setting up the circuitry is not important to me. Because the anesthetic machine, for the most part, when I set up an anesthetic machine, is not running yet. So as long as you get everything hooked up properly, that's fine. The next part of that practical, you're going to be given 4 cards, 4 only. And they're going to have one of those 11 things will be on each of the cards. That's when it's important that you understand flow through the machine. And why that's important to me is when you get out, I cannot promise you that you're going to get a machine that looks like this. So if you understand, if you have the basics of understanding of flow through the machine, you can set up most machines. So that's why that's important, that you be able to, so you're going to need to show me where each of those 4 things, and those 4 things only, you don't have to show me every single thing on this machine. Just show me where on the machine it is, and the order that the gas flows through those 4 parts. Okay, so if I give you, say, oxygen, pop-off valve, scavenger, and inhalation, you're just going to hold it up to that. So you're going to take the card that says oxygen and hold it up to that. If we get to the inhalation valve, and it will be the system you've set up, if there's other students in the room, I mean, it's hard for you to hold a card up and me be certain which hose you're talking about here. So I may say, what color? So I'm sure that you know which is the inhalation and which is the exhalation. Or I forget what else I said. You may, some students are fine just showing all four in the order of flow to the machine. Others just want to show me where stuff is, and then they'll lay the cards out in terms of this is where the gas hits first, second, third, fourth. Either way, I'm fine with. You will have another station that you'll be given. It's a laminated sheet of paper, and there's 2 questions on it to do with induction equipment. So I'm not going to give you the Doppler blood pressure and say, here, I want you to hook somebody up to it. I'm not going to give you, well, I can't give you a pulse oximeter because I don't have it. How do you hook it up? But there'll be questions that we talked about in class. So you might want to, be ready for, if an animal has hypotension, how do we treat that? That's the type of questions you're going to get on it. Okay. Now, a lot of this may also be involved in the written test too, but that's exactly what you can expect on the practical in here.
How much are those questions worth?
Well, the questions will be part, so you know how when you normally have a rubrics, there's usually 5 things on there, set up the machine properly. So one of those questions says, did you answer the questions properly? So really, it's not, I don't know why you're concerned about that, because it represents 1 mark out of 5. Not that much.
2 questions total, 1 mark out of 5?
But don't use that as to say, well, I guess I won't study the induction, or the that equipment, because there's going to be other questions on the written test to
So
do
what would
with
it
the
be?
monitoring equipment.
The induction, the doubler, doubler.
You might need to do some study before next week.
What else?
So you guys tell me, what other pieces of monitoring equipment have we used? What is it? What's it called?
Yeah, the endoscopial. I can't say it.
Esophageal stethoscope.
Yes.
Wow, I didn't even
Okay.
get that one.
Doppler blood pressure. What else?
The systolic thing.
Systolic is the Doppler blood pressure.
Oh,
Okay.
Oh,
Pulse oximeter.
got some studying to do.
Catheters.
Catheters are not so much monitoring equipment as something you would use in induction, but know what you need to have in induction.
The respiratory.
Know how you would prep an animal for surgery. So don't, this is everything we've done in the last few weeks. What is the respiratory piece of equipment called?
I forget the name.
AP.
Oh, AP alert.
Yeah, or app alert.
App alert?
App alert.
Did you do it?
There's one other obvious one.
Thermometer?
Thermometer. So there's 5 pieces of monitoring equipment there. You might be asked that somewhere along the way, so know that. Okay. Did you have a question? No. So it's almost 1:45. I would suggest, if you haven't done it, come up, just make sure you're comfortable with what tubes go where, if you haven't already been forced to come up here and do that. Because unfortunately, I can't put this in the animal center for you, so that make sure you're comfortable with what goes where before you leave this lab. And if you're otherwise comfortable with that, see you next week. Oh, you will get something that says what time. Okay, like I've done on all the other practicals. Within this hour, what time you'll be tested on.
I'm just gonna get a picture of it.
Okay, so go ahead, hook it up, do what you gotta do. Now, on the back here, we've actually done a schematic of the flow. I've had a couple students ask for that. Oh, Terry, you were one of them, okay? So that basically shows one to the next, to the next, to the next. If that helps you to learn, you've got that there for both systems. So, see, I didn't finish. This is your non-rebreathing system.
Yep. There. No, the black one.
I know, that's what I was doing.
You can say no.
Oh,
Here.
I want to know what I want.
So if you're going to show flow, that's flow. Right, all the way through.
Okay.
What's there, what's in what order, etc., etc. Okay? Can I show you something else just before you go, because I think it will be helpful to you? There is a schematic on the test, which is kind of like a stick figure drawing of that machine. I'll tell you already, it looks more like something like this. You know, there's usually like a square, and then a circle, and then whatever, and then it comes off, and it goes like that, and this is in there. This is what you're going to see on the written test, which is a little bit hard to translate from when you're looking at this, or even our wonderful drawing here that Carol has created. But I have taught you enough to figure this out. And I'm going to ask one question off the get-go that should help you. If you had to try to figure out where the rebreathing system was, even on a schematic like that, what did I teach you? Identifies rebreathing over non-rebreathing. What's one God that the other doesn't have?
Soda line.
Soda line. So if you see something like this that's got a square in it like that,
Bam.
you know. Okay? But if you want to have sort of step-by-step flow, and I've written on here under this basic flow, your oxygen tank, your pressure regulator, I don't have that to show you, unfortunately, at Sheridan. So what that's represented by, I've written on there, is your white tube on the anesthetic machine. So this represents the oxygen. Okay? It's important for you to know on your O2, on your oxygen flow meter, that flow is liters per minute. The vaporizer is set in percent. So these are all things I've given you, but think about them. Make sure you're comfortable with them. If you're not comfortable with them, and you think of it after you leave this lab, send me an email on Slate. I check it every day, usually on weekends before a test I do. Mind you, I have to write my own tests this weekend, so I might be a little shabby on Saturday, but I'll check for sure by Sunday night. Okay?
So, you, on the non-rebreathing one, you're under, right?
Right.
And then rebreathing, you use over.
Right. To me, in terms of your practical and what you've got to figure out on that, that's one of the easiest things, because it's simply that. I'm going to give you a case that's got a weight on it. Look at the weight right away. Oh, rebreathing system, non-rebreathing system. That's easy. The hard part is making sure you get the right things hooked up to the right things here. Now, Carol made somebody a promise that he was going to try and tape this whole thing. And it was taped good. And put it available to you. So I did. I had a student do it a couple of years ago, but I lost track of him and what he taped, because it's helpful for studying to have that. You know, especially when you don't have this machine available to you to look at it.
So what was the thing that you were saying when you were standing at the back? Know something in...
What did I say?
I don't know.
What was the question again? What was that?
Don't you need to know
Something about milliliters or...
Right.
Oh, the oxygen.
So I'm not requesting that you set the flow meter and set the vaporizer, though, I mean, if you're running an anesthetic machine, that's absolutely important for you.
Mm-hmm.
But my objective in teaching the anesthetic machine is knowing how to set it up properly and understanding how things flow through. These actually become quite easy when you get out there, but they're just based on the weight of the animal or the size of the animal. So your oxygen flow meter, I won't be saying you've got to set that.
So what is it?
But what you do need to know about this is when you are setting it, the measurement of your oxygen flow on here is in liters per minute. And I can promise you there will be something on the test about that. So make sure you're clear on that. The vaporizer, I won't be saying you've got to figure out how much to give this animal. You don't have to do that, but you do need to know where the vaporizer is. You need to know what the vaporizer does, and that it actually is set in percentages. Okay? The other thing that I don't require you do, though I find students do it anyway, and I'm fine with it, I don't ask you to ensure that the pop-off valve is open. It should always be open in the systems I'm teaching you. There are other systems that don't do that, which are the main ones we're learning, but I'm not going to be checking to make sure that you're ensuring it's open or closed. Those are the things I won't be testing you on. Everything else, fair game.
Ruth, what did you say before with the vaporizer?
So your oxygen flow meter,
Okay, see you later.
know where it is, know what it does. So this is what decides how much oxygen is going to my patient.
Do you mean like where it is on the actual machine?
On this machine. Where is it? There it is. There's O2 right there. But don't get that confused with this O2. Because this decides, this just gets oxygen coming into the machine. This decides how much is going to my patient. Okay? And this is measured in liters per minute.
Are you gonna ask us what we, like, if we have to bag the patient?
I won't ask you about bagging a patient on your practical, but there will be questions on the written. I just finished doing the written test today, so I know there's a question or two on that. So understand why you're doing it and how to do it. Does that help? Tara? Does that schematic help?
Actually, just doing this again today helped.
It's a little confusing, but I think that, like Carol said, it's easy though when you've done it 100 times. But really, it's not that much. You're hooking up a bag and 2 hoses. That's it. But you've got this and that and this, and I understand there's a lot to it. But I think the more you just go through it, hopefully the clearer it gets. And that's why this was an open lab today, though I find most of the time it sort of helps to sort of guide you, but ask any questions you have. Get them clear in your mind before it's time to write. Yeah? Are you feeling comfortable with all this?
I still get it confused.
Okay, well you've got to study that then, because I mean, just get your notes, what's the rebreathing, what's the non-rebreathing, and go over them until it's clear in your mind.
Are those the tubes that you're gonna have?
Yeah, I'm not going to put different tubes out. Now that's not good because really, I really shouldn't have you, because you're going to know one's blue, one's green, and that's not reality out there, but I'm not going to try and trick you that way.
Okay, good.
Unless I change my mind.
Don't, because that's how I remember. The smaller animals go on the rebreathing and green.
But I taught you a great way to know that, and you don't have to care about color. The smaller tube for the smaller animal. If you have to do this, and look at the 2 together, I'd rather you do that than remember blue and green. Because this one is obviously bigger, and that's more going to help you when you get out there. Because they're not going to have just a blue or green tube necessarily where you go. Okay?
Yes, they are. I can submit.
You heard her say it, right? I do not support this. But anyways, no, I'm not going to switch up the tubes.
Okay, good.
Okay? I'm going to just ask you guys this before I go. I find when students are doing it, you really like to plug things in well. And I'm going to... I have trouble getting them apart sometimes in between tests. So just don't feel like you have to really push it in. Okay, if it falls, don't worry. I'm not going to worry about that, okay? But I see some students and they're going, well, then I have to go to get it out. Just absorb it. Okay? You don't have to push it that way. No. You need to know what the pop-off valve, you need to know the fact that the pop-off valve, how it relates to the scavenge system for the written test. But for the practical test, I'm not gonna go like this and close it when you're coming in and then I took your mark off because I didn't open it. I won't do that to you. Okay? But I'm happy when I see students checking that, because that's a bad mistake to make, to leave that closed.
If we forget to open it,
It will be open anyway.
Okay.
There's no reason that anybody's being tested that would be a reason to close it, so it should be open anyway.
But you close it when you bag, right?
Your bag.
Because I that's the time it's closed, right?
Yes.
Okay, that's the time I ride.
And it isn't closed for very long. Close, squeeze, open. Close, squeeze, open. Close, squeeze, open until that animal starts breathing again, which hopefully does.
And then what you would do is switch off the
Anesthetic.
anesthetic.
What do you do before that if you've got an emergency? What do you do before you turn off the anesthetic when you've got an emergency?
Love that.
Good.
Pretty much anything you do, we still bet.
basically? Yeah.
Yeah.
Yeah, I think it's a good idea. Or somebody. You know,
Yeah.
there's some things that aren't emergencies, but like, yeah. I'm not telling them, but you go. When you take CPR, that's what they say to do. Go get.
Go.
You know.
Yeah.
Okay.
I love when I was doing my CPR, my qualifications for first aid, that you're supposed to tell somebody other
In video.
than you knowing. So that was the one guy, we're being tested, and the one guy is like, yeah, so I just texted you.
He texted. Oh, I won't take this apart because some of you are taking pictures. Any other questions? And same thing, if you're studying and you have questions, email me on Slate. I'm checking every day. Not multiple times a day, but at least once a day. So if you don't hear back from me to the next day, you just got in after me.
And you're not going to put on the test just specifically 8 kilograms, right?
I won't do that. No, but the joke, as I said, if something happens to me and Carol comes through the testing, I can't promise you. But no, it's all, I don't ever ask. But you're ready for that, right? Because if it's 8 kilograms or more rebreathing, 7.9999.
It kind of makes sense, rebreathing for a bigger dog. That's how I think of it.
Right, but what you should be clear on is why. Why rebreathing for a bigger animal?
Bigger lungs?
Not just bigger lungs. They tend to, as the anesthetic slows things down, they have more strength to move air back and forth, because this system, this circle system, has something to do with him breathing in and out. Where this, remember, I'm spoon feeding it. My flow rates of this stuff is much, much higher to my animal. They're getting lots and lots, more than they need almost. Where this system, his breathing somewhat drives the gas that he gets. Somewhat. Okay?
Now, will we have to say that in the test?
You won't have to, but I want you to understand why, because it's dumb for me to say, oh, just memorize it. Understand why. But on a test, you might get something that says, you've got an animal that's 2 kilograms. Which system will you use? That's the kind of question you would get. You still have 5 minutes if you want to come and set this up or ask any more questions. We'll chat for a second.
Yeah.
All right.